So another reason why disparity is a problem is because the system responds slower to crisis for minority children. Less supported services are offered to them. Less comprehensive services are available. Parents are viewed as less able to profit from services and subjected to harsher punishments. So, a little bit about the history of the child welfare system for children of color. In the 19th century, early child advocates were influenced by their own race and class, and they sought to remove children from unfortunate circumstances. Charles Lauren Brace, a Protestant minister and early child welfare pioneer, became the foremost renowned representative for the child rescue movement. The orphanage movement gained considerable momentum, and in the late 19th century, the Catholic Church built numerous institutions designed to provide care for a growing number of children abandoned and neglected in the abject poverty of the cities. And while these preparations for the nation's white destitute children were being made, African American children generally did not receive similar child welfare services until after the civil rights movement expanded equal rights for African Americans as a whole. African American children as well as potential African American mothers, were virtually locked out of the public child welfare system for decades. Furthermore, despite the higher illegitimacy rate of among African Americans, the existing facilities that care for unmarried children and their and mothers were almost exclusively for white unmarried mothers. While when early attempts to provide institutes for African American children did arrive, they were initiated by African American women organizations, black churches, and individual black community organizers. Examples include the Big Sister Home for Girls, the Meg's Reformatory, and the Carrie Still Orphanage Home. In 1973, a class action suit went up against New York and Wilder case, which launched in order to gain equity for African American children in the city's foster care system. Until that point, private secretary and charities, which controlled the area's foster care beds, were legally able to discriminate and to use government funds to facilitate placement of children of their own group, ethnic groups, religious background, while African American children in care waited for placement over the more than 2 decades, where with countless delays, the suit succeeded in bringing about the change in the law. But for the years prior to the change and during the progress of the suit through the courts, the right of private agencies to use public funds to treat children unequally was defended by many of New York child welfare systems. Before the civil rights movement in 1960, interracial adoption was uncommon. Several states, including Louisiana and Texas, had outright banned the interracial adoption. Before the 1960s, however, courts struck down laws against interracial adoption, increased the number of white parents adopted children of color. During the 1970s, critics of interracial adoption mounted a spirited campaign against the practice led by the National Association of Black Social Workers. The group um, exaggerated the problem by uh, whites by basically said it was an issue with white people adopting African American children. In 1978, passage of the Federal Indian Child Welfare Act established tribal authority in determining child custody. It required states to determine tribal affiliation for children and give notice to the family child members before the legal proceedings could begin. And during the 1980s and 1990s, pressures mounted lower racial barriers to adoption. In 1994, Congress passed the Multi-Ethnic Placement Act. The 1994 MIPA prohibited child welfare agencies from delaying or denying adoptive practice placements on the basis of race, yet MIPA was allowed to race its factor of placement decisions. The Adoption Assistance and Child Welfare Act of 1980 requires states to make reasonable efforts to avoid removing children from maltreated parents. When removal was necessary, reasonable efforts were required to reunite families. However, this caused families to be left more unsafe. Congress responded in 1997 with the adoption of Safe Families Act, which uh, which did not completely abandon like the child preservation, but it made it more safe for children. But the problem with that was that it created new barriers and heavier caseloads in a short time frame for unification for workers working in poverty areas, and the state seek termination after 15 to 22 months, and foster care was basically affected more than African American children, and policies decreased workers' input, and it took away money from the reunification efforts. The Race Matters Consortium and National Multi-System Initiative that promoted strategies that prevent, intervene, and eliminate adverse racial disproportionality and disparities. It also worked towards developing racial equity and child welfare system. They had their first conference in 2001. The Pew Commission on Children in Foster Care recognized the problem in 2004, and United States Government Accountability Office recently reported on the issue in 2007. And they were tasked with figuring out what was the factors influencing disproportionality in the child welfare system, seeing what the states can do. Yeah, what they can do about it, and way federal policy may have been influenced. In 2006, the Center for Community um, Partnership and Child Welfare, part of the Center of Study Social Policy, published a uh, places to watch on overview of practices during different states and address racial disproportionality in the child welfare system. And in 2000 and I'm sorry. Oh, okay. And then immigration in the U.S. in recent years has impacted the child welfare system, and due to the relationship between like social economic status and maltreatment policies that affect child welfare system, such as welfare and TANF and things like that, also have an impact on how many kids are going into the child welfare system, because if programs are not available, then um, neglect and abuse arises. So, other risk factors for children of color, external factors include poverty, family instability, lack of resources, discriminatory practices in the larger society, family characteristics in the media. Poverty related issues include strong links between low income and incidents of abuse, and minority children are usually in low income groups. There's a need for services versus the lack of services, so services aren't there in place. Community and family characteristics, including less about race and the effects of poverty, disadvantage, and things like that. Family support groups, where some groups are more supportive than others. Um, More risk factors include discriminatory practices, over-reporting of minority biases held by medical and school systems, untrained professionals, media, as we talked about before, high-profile cases influencing reporting, and internal factors, workers' bias, and agency practices. And this is the chart that kind of gives you a better idea of things that's influencing the disproportionality and disparity in the child welfare system that I just went over, but it breaks it down into disproportionate needs, human decision making, placement dynamics, policy impacts, and agency systems. So, micro interventions are alternative response systems, recruitments, basically designed to identify and engage at-risk families before they come into attention with former welfare systems, recruitment and support efforts of minority, foster, and adoptive parents, constituent engagement, Frontline, which is a program improving the child protective service and investigating. The initiative is intended to give intake workers a tool to make thoughtful and informed assessments. Family placement resources in the community of origin. Um, the department aims at increasing the recruitment and development of more families set in foster care resources within the community, which children are foster into, and working on mandatory reporters. So meso interventions include agencies have called for resources, greater endpoint and decision-making policies and practices, more comprehensive child and family welfare practices to address indigenous disadvantages, family placement resources, and community. Well, that goes to the other one. Data sharing amongst different groups. And macro interventions include strategies or reviews concluded. Successful state intervention includes strong commitment to racial equity, monitor racial differences and qualities of outcome, development of agency collaborations, improved and expanded service provisions, partnerships with the community, and changing policy responses to overrepresented and underrepresented groups. So just looking at Pennsylvania, because I'm from Pennsylvania, that's where I'm most likely going to be practicing it. The issue basically is the same. African American children are 6 times more likely to be in foster care than white children, and Latino children are 3 times more likely to be in foster care. Current Pennsylvania law prohibits data collected by race and ethnicity in the child line and abuse registry. Um, Addressing the issue, what Pennsylvania is doing. Policymakers and practitioners alike should review comprehensive data by race and ethnicity, recruit and train workforce that's culturally competent and reflects the diversity of the neighborhood. So the workers should also know about the culture of the neighborhood. Improvement in practice at key decision points like the ones we talked about early. And this over here just gives the breakdown of 2012 Pennsylvania racial disproportionality profile. So some of Pennsylvania's current initiatives are the Inua Ubuntu, a system reform model developed in Allegheny that's aimed at reducing racial disproportionality in the foster care system, and cultural consultants, which are charged with walking intensively with families on the variety of working with families on a variety of goals and the welfare and involvement in outpatient, out of home placement. Um, some of the evidence-based resources from the California Evidence-Based Clearinghouse is the Undoing Racism, the Race Matters, and Minority Youth and Family Initiative for American Indian Alaskan groups. And you can see I have contact information for them, or you can just go on the clearinghouse, and these are just some more programs that have been proven and researched to work with kind of mitigating the issue of disproportionality. And this is one that I highly recommend that you can look at if you have the time. This is also on the clearinghouse, and it's basically the program is called Community Partnerships, Improving the Response to Child Maltreatment. So this is a sector that you're going into. I highly recommend that you look that up. And a new trend is going towards basically saying that researchers have concluded that trying to reduce racial bias in the system is not the way to address the inequity between blacks and whites and child welfare. Instead, we need to address the underlying social conditions. So it goes back to say that that the system is not inherently racist, that basically racist things that happen made biased policies and affected the people in those communities, therefore making them more likely to need services. And these are my references. Thank you.